Zubir Ahmed.
Sir Chris, your anecdote about the vascular ward does resonate strongly with me as a practicing vascular surgeon, and many of my patients leave hospital with less legs than they entered generally. But the comment I want to make and ask you to make a comment upon is the chronic disease burden. As you all know, there's an epidemic of chronic disease in our country, and it's rising, and it's probably going to require various public health measures to get that back under control. I wonder if I could ask you to make some comment about how you feel the impact of this legislation might impact upon the chronic disease burden on the NHS going forward, not only in the short term but in the long term.
Thank you. So I'll give a view, and Sir Gregor, I think, will want to add to it. I mean, it will make a very substantial difference to this. I think the thing to understand is not only does cigarette smoking cause individual diseases, many people, as they grow through life, have multiple diseases around smoking. So they will start off with, let's say, heart disease as a result of their smoking. They will go on to have a variety of possible cancers. They might have chronic obstructive airways disease. They will end up potentially with dementia. All of these would have been either not happened at all or would have been substantially delayed had they not smoked. And of course, this is heavily weighted towards areas of deprivation, people living with mental health conditions, and other areas where it's really unjust, I think most people would consider in society. So I think all of us, and I think anybody who's looked at this in public health terms, would say if you could remove smoking from the equation, the burden of chronic disease would go down very substantially and be delayed. And the inequalities of that burden of disease would also be eroded. So the arguments for this, I think, are really clear.